Hi, Jonty.
Hi, Falaki.
So what is your role in the Integrated Care Board and Integrated Care System?
My role is medical director. I guess what's important is to understand the context in which I work. So I work on the Integrated Care Board. We have responsibility in the system for thinking about how we plan and pay for the care for people who live in South East London. So my role very much is to work in partnership with others on the board to think about the care, the quality of care, the experience that people have in South East London and how we can continue to improve that through the work that we do as an Integrated Care Board.
What are the kind of changes that you've seen over the time that you've worked in South East London in our health and care system?
We've seen significant changes in terms of the kind of technological and treatment advances that there have been in the health and care service. But I think what I have probably noticed the most is the fundamental shift there's been to trying to think about how we move from being a service focused on illness to a service focused on health, how we think about prevention in that context, helping people to stay healthy, but also thinking about how we involve our local communities much more in the work that we do, and particularly work to address some of the inequalities that exist across our communities.
It is a big challenge that we're facing. How do you think we can address it?
From my point of view, change is not going to come about through the heroic leadership of individuals. It's going to come about through us really unleashing the potential that exists within our local communities and our voluntary and community sector, and also from our frontline clinicians and care professionals across South East London. And we need to furnish them with the capabilities that they need to bring change about. So one of the things that I've been very focused on is thinking about how we enable people to have the skills that they need to really start to tackle some of those challenges within quite a complex environment. So thinking about building system leadership and ensuring that actually we spread that out across our communities and our care professionals feels fundamental to addressing the challenge.
What advice would you give to new leaders, to emerging leaders?
It's very much about being curious in the first instance. I think inevitably when times are tough, we tend to look down, we tend to batten down the hatches. Actually, this is the moment that we need to look up. We need to be curious, we need to look out. There are lots of people who are also tackling some of the same challenges. We need to connect with them. And that's the other really important thing. Connection and relationship will be the only way that we bring about change within our system. Building strong connections, working across organisational boundaries, developing our partnership is going to be fundamental to tackling some of the challenges we face. And that would perhaps bring me to the final encouragement that I would give, which is around courage. And courage is all about having heart. And from my point of view, we need to enable those people who often are not heard within our communities, within our system, to have the courage to speak up. We need to listen and we need to enable them to much more actively participate in the work that we do.
So we know that for people, health is only part of what affects their well-being. We know that it's a broad range of things. And so where does the role of the NHS start and stop?
Naturally, we have tended to think that we have to solve all of the problems that exist for our local communities. It's really important that we recognise that that is not within our gift, but not only that, we need to rebalance the power that exists across our local communities so that actually we ensure that they have the agency and the autonomy that they need to be able to bring about that change, to tackle some of those wider determinants of health and to address some of those inequalities. And we can do that through a different sort of partnership with Health Watch, different partnerships with the voluntary community sector, who we know have those deeper connections into our local communities.
And what about diversity and inclusion, both within the system itself in terms of staff but also in terms of access to health itself?
We will not solve some of the challenges that we face as a health and care system if we do not include a much wider array of voices within the decision-making process. It's really important, not just because people should feel heard, but actually because very often I've found that they understand the problem and are able to support a very, very different solution to emerge. So there's something about that diversity actually improving the way in which we make decisions. It's not going to happen on its own. We have to actively build that into the work that we do, engaging with our local communities, involving people more actively in our decision-making processes, and ensuring that actually we have that amazing diversity of perspectives that can only help us to address the problems we face much more effectively.
What are you most proud of?
There is nothing that I can possibly take responsibility for individually, but perhaps the thing that I'm most proud of that I've been working on recently in South East London has been our System Leadership Academy. That for me demonstrates some of the understanding that I've come to as a leader about how we bring change about within our system. It's very, very focused on creating the opportunity for individuals across our different organisations to come together, to learn together, to share their experiences, to connect with each other, to be given the skills and capabilities to lead within our system, and actually to understand what techniques they might use to scale some of the innovation that they have within our system.
What are you most optimistic about for our South East London integrated care system?
The commitment that I've seen very, very clearly demonstrated to shift power, and that means in our system also shifting resource into our voluntary community sector and our local communities to really demonstrate quite a deep commitment to the potential that exists to address some of those health inequalities that are so fundamental to our mission as a partnership. And I think for me that is a really important lesson, and that I think will ensure South East London has really strong foundations as it moves to integrate care and improve the experience of our population and the outcomes of care that they receive.
Thank you, Jonty.
You're welcome.